All right, well, let's jump into some segments. Talking about, well, we weren't really talking about segments, but let's jump into them anyway. So I have like a really big update on a segment that we did in December. And it was about the plastic surgeon whose wife died while he was doing surgery on her. Well, she went into cardiac arrest while he was doing surgery on her.
I literally was just on social media and saw an article about it.
You just saw
literally saw one.
Yeah.
Just right off the
bat. So when we did the segment, it had like just happened and there was really not a lot of information out there. So just to kind of recap, so this guy, he's a legit plastic surgeon, named Dr. Benjamin Brown, was operating on his wife at Restore Plastic Surgery in Gulf Breeze. And the short version, and we'll dig into a little bit more, is that she had a seizure and went into cardiac arrest. And then she went to the hospital and they said she was brain dead, and she apparently died like a week later, which is terrible.
Was it local? Or is it?
Well, I'm going to bring up a clip. So, so now that 7 months have gone by, there's this huge investigation, and this week he was arrested, and he was arrested for homicide and negligent manslaughter. And like I said, when we did the segment back in November, there was not a lot of information, just that there was a plastic surgeon, his wife was having surgery, she died. But I speculated on it, so I want to roll the clip from last November, and please excuse my hair, because this was in my Ken phase. So, all right, roll that clip. So the little bit of detail. So I got this from all the news articles. She was having multiple procedures. The patient had multiple seizures in the OR before she went into cardiac arrest. In the 911 transcript, it was stated that the doctor possibly over-medicated the patient. Okay. The doctor stated that he used a different medication due to the regular medication being unavailable. So all of that to me points that they were doing surgery under local anesthesia. Now, that was not stated anywhere, but all of those things kind of fall in line because local anesthesia toxicity, the most common thing is central nervous system problems, of one of which is seizures. I mean, that's kind of the classic, serious complication from getting too much local anesthesia is you have a seizure. I really am kind of against people doing major surgery under local anesthesia. Mm-hmm. All right, so now that a full investigation has been done, that actually was exactly correct.
Nice.
That
you knew.
Well, I mean, I can't say it was like a genius call, but it was a smart call. I mean, based on what they had said, it
all
was
the clues.
Yeah, it was most likely. So there's a lot more information, and when we did this segment, I kind of gave this surgeon the benefit of the doubt. I was like, well, maybe this was just really an unfortunate accident or some mistake happened. I've changed my tune. Now that I know the details of this, it's pretty egregious. And
he was just being careless.
It's pretty bad. This is really kind of just flat out. I mean, I'm not surprised at all that they arrested him, and I think without question. Well, I don't know. I think based on what I've read on the details of this report, I think there's no chance that he gets off on this.
Do you think he did it on purpose?
That is very interesting and something that we can pontificate on. I don't know.
He purposely was like, maybe I could just kill her and
well,
make it look like an accident?
Let me tell you guys the story and you tell me what you think. All right, so a couple things have happened. First off, the health department restricted his medical license this spring, said that he basically could only work in a licensed hospital under direct supervision of another surgeon. So they did go into detail about what surgery she had. She had a abdominal scar revision with muscle plication. So what that means is she at some point had an abdominoplasty, and probably she had some healing issues along her incision, which is actually pretty common. And then she probably had a little bit of relaxation of the rectus muscle repair that's done. So they were doing a scar revision of her abdomen and a rectus muscle plication, liposuction of her arms, lip injections, and ear adjustment, which I'm guessing is an otoplasty, meaning her ears may be stuck out a little far, and so he was doing a ear pinning. I guess that's the only thing the ear adjustment would mean to me. Here's where things get weird. The patient, the wife who passed away, prepared her own tumescent IV bags, meaning she mixed up her own drugs that she was going to be given.
Is she a medical?
No, she's not. And that's another thing, is that this guy has had several people in his office doing medical procedures or, things medically related that they have no training for. So she mixed up her own tumescent IV bags, and then took a bunch of pills. They didn't, that's just all it says is she took like a handful of pills. There's no documentation of what she took in the records, which is the reason that they really went after this guy. He didn't document what was in tumescent fluid. So tumescent fluid, for those who don't know, when you're doing liposuction, you first inject fluid in, and that fluid has lidocaine, which numbs it, epinephrine, which keeps you from bleeding, and bicarbonate, which keeps all those medications there. So that's what tumescent fluid is. You inject that in to saturate the tissues, and then you suck out the fat. They didn't document properly what was in that. So they started doing the procedure. It gets even weirder. The patient started closing her own incision, is what that the documentation says. She started closing her own incision because she's awake, right? It's a local.
In her abdominal area?
I guess it doesn't really say. I mean, it has to be that because I don't know what else it would be. But then she started to complain of the symptoms of lidocaine toxicity. She started having muscle twitching. She said her vision was getting blurred and she felt unwell. And this is where really I just want to throw the book at this guy. So instead of like stopping, the guy continued to inject her with more lidocaine. In fact, they ran out of tumescent fluid, and per this report, he started injecting just straight lidocaine into her to keep doing the procedures. And then that's when she started, like shortly after that, she started having seizures. Like to me, that's just unacceptable. I mean,
did he take the handful of pills?
Maybe, I don't know.
Was he on drugs when he did this?
I'm not sure, but like that's just not acceptable. If somebody's having symptoms of lidocaine toxicity, and there's no world that exists ever that you should continue to give them more lidocaine. That's just absolutely insane because when you inject that stuff, it doesn't just instantly work. I mean, some of it gets stuck in the tissues and then it gets absorbed. And so even if they're just having mild symptoms, even if you gave them none, they could go on to like seizures or, cardiac arrest. Why in the world would you give them more? It just makes no sense whatsoever. So when she had a seizure, the medical assistant asked several times to call 911. The guy refused. He's like, no, I can handle this. I can handle this. And so they're saying it up to like 20 minutes went by after she had a seizure before they either called 911 or started CPR.
She like dead?
Did she die?
I mean, was she like dead within those 20 minutes whenever?
Well, it didn't say specifically at what point she went from seizure to cardiac arrest, so I can't answer that for you. I mean, at the point someone has seizure, you need to start some life-saving things like airway, oxygen, all that. Apparently, they didn't really have any of that kind of stuff there, which is the reason that you really need to call 911 like immediately, because if you don't have the stuff that you need. So yeah, that's pretty insane. That we did a story very similar to this where there was a doctor that someone went in cardiac arrest and he refused to call 911. So
so much pride.
Yeah, big time. Health department found some other violations. Oh, this is crazy. So this patient did 2 BBLs on patients who didn't ask for them, allegedly, meaning they came in for one surgery. I guess they came in for liposuction and then they just wanted liposuction, but then he injected the fat into their butt without their permission. Like, that's crazy. I mean, that's straight up malpractice.
That's creepy.
Yeah, and so, and then also I talked about him having people in his office doing unlicensed procedures. So yeah, I mean, after hearing kind of the details, of course, this is all from the report. This is all public information. I mean, based on what they're saying, I mean, this is just beyond malpractice. I mean, obviously it is because they arrested him, right? You don't get arrested for malpractice. Like this is, negligent homicide. And I don't know.
There's something wrong with him.
I mean, I don't know. I mean, there might be. I mean, based on like all these things that he did. I mean, a lot of these things that he did where he had, you're having the patient sew themselves up when they're not, even if they were a medical person, like having them sew themselves up, like that's
weird.
That's just weird and crazy. And then, not calling 911, and then also,
especially for your wife.
I know, right? I know, it makes no sense.
I feel like doing surgery. I mean, and I don't know if you've ever done surgery on your wife, but it's like I feel like that's like a lot of pressure.
So it's funny.
I mean, that would make me feel a lot of pressure. Like if I had to do like surgery on Avery or something.
Yeah, I mean,
I was a surgeon,
and I'm going to bring this up in just a
scary.
second because there's more to this story. We talked about this the last time when we talked about this very same story. So I've operated on my wife, both my kids, my mom, my brother. I think that's it. So I mean, I personally, I think if you're doing something that is very, routine and not life-threatening, I mean, I don't have any problem doing that.
Yeah.
There is definitely some criticism if somebody was doing like major surgery on a family member, and that generally is not allowed.
Yeah.
But I mean, like I said, I've done surgery on all my family members, but it's like, the stuff I do is not life-threatening.
Yeah.
And if something were to go down, typically the anesthesiologist is the one who has the best advanced cardiac life support. I mean, I used to run codes all the time when I was a trauma surgeon. Those days are past for me. I mean, I still know the ins and outs of it, but I mean, if a code happens in the OR, the anesthesiologist is going to run the code.
Yeah.
So, but it's interesting that you mentioned that. So there's been a lot of talk about this in Florida since this has happened. Of course, there's been a lot of outrage about, how bad this situation was. So in classic like government fashion, like these two lawmakers have rushed to make a new law to try to protect people, which honestly I'm all for, because Florida is like the Wild West of plastic surgery. I mean,
it's a weird place.
People get away with crazy stuff out there, stuff that just really
just do weird stuff down there.
I mean, it is an odd place, and I love Florida. I love the vacation there, but man, it's different attitude out there. So these two lawmakers, state lawmakers, Michelle Salzman and Alex Andrade, have come up with the brilliant conclusion that the reason that this all happened was because it was his wife. And so they're trying to make a law that says that it's illegal for you to operate on a family member.
The reason all this happened is because he thought he could get away with it.
Right. I mean,
like he kept getting away with all the other weird stuff he was doing.
It has nothing to do with the fact that it was his wife. Like zero to do with his wife, unless you're, have something there where he did it on purpose.
Yeah.
Which I don't know. I mean, I'm not saying that at all that that's what happened, and no one else says that. But man, when you do something so egregiously just out of the standard of care,
what was he thinking?
It makes you wonder.
That's why I'm like, was he on drugs?
Who knows? Maybe.
Was he the one who was like, let's both take some pills together?
They probably would have. They probably would have tested him, I would think.
You would think so.
I don't know. But yeah, I just was like so annoyed. It's like, something happens and people rush to make laws, but they make laws that really have no bearing whatsoever. I mean, how many times has a wife died from surgery that their husband did in the state of Florida? This has to be the first time. I've never heard of that prior. But people die literally all the time in Florida from this exact same thing. Like they're going after the wrong problem.
Yeah, it's the wrong demographic.
Yeah. It's like, it's just not, it's like, it's like if you, it's like if you want to make a law for cars to make them safer, and
how about they can't do local anesthesia stuff anymore?
Right, exactly. Okay, let's be smart. So like, what do I think are the reasons why this person died? Number one, big surgery under local anesthesia. I mean, how many times have we talked about that? Like,
that's what they should put into law.
Yeah, dozens of times. I mean, so many times when people die from plastic surgery, it's from people getting big surgeries under local in very shoddy, facilities that aren't, really equipped to handle a surgery that big and don't have the equipment that they need. Like that is the number one problem here. You did a big surgery under local anesthesia. I mean, literally people die every single month for sure in plastic surgery from that. Why in the world wouldn't they go after that? It makes no sense. I think the other thing too that is really a root cause of this is surgery in an office with no oversight. You have somebody saying, let's call 911, and the doctor's like, no, we don't need to call 911, when obviously you do. You can't get away with that, like in a surgery center.
No.
If you're in a place that has oversight, there's no way you can get away with that just level of stupidity.
Yeah.
And so, I mean, if you want to make a law, like maybe make a law like no big surgeries in unlicensed facilities.
Abdominal surgery, man, though. That's like serious.
It's pretty legit, yeah. It is, yeah.
You got some vital things in there.
Well, it would be like superficial, right? So if you're placating
it's like
the muscles,
yeah. But still.
But I mean, doing that under local is pretty crazy. I mean, because that's a painful operation. I mean, the amount of local you'd have
and then she was told to sew herself up. I just cannot.
I know, it's just crazy. And then, the last thing I think causes is just gross negligence by the surgeon. I mean, there's just so many things that were done wrong in this.
Allegedly sounds like a horror.
It's crazy, right? It's almost unbelievable when you hear it all listed out. Yeah.
That's why I'm like, literally, I'm like, were they like just both of them like up one night, like it's 1 a.m. and they've been drinking or on something?
let's do surgery.
Let's do a surgery.
No, it was like at
Let's
6
be
o'clock in the
crazy.
evening. It was kind of late in the day, actually.
Yeah, that's what I'm thinking. Like, were they out getting margaritas and we're like, let's do a surgery real quick?
I mean, it's just insane. Like I said, when we did the story the first time, I was like, oh, maybe things happened and, it was like a simple mistake. But I mean, there's just a lot of
No, you don't. Yeah, we don't feel sorry for him anymore.
Yeah, there's a lot of really, really bad things that happened there.
Yeah.
That, that lady should not have died. I mean,
No.
There was a lot of bad decisions made that were compounded by more bad decisions. And, when someone died from it, and then you get the bad decision of lawmakers to try to fix the wrong problem. I mean, I don't know. It's just like the crazy people are running the asylum.
Yeah, I think he's going where he's supposed to go.
I don't think there's any way whatsoever he'll get off from this. I mean, I bet what they try to do though is they'll probably try to pin it on her that she mixed up the wrong drugs or something, which is still, it doesn't matter. Like that doesn't, make it okay or make it not negligence.
It's so weird.
Yeah, crazy story, right?
I do not approve.
I don't approve either. Like I hear these things and like it just makes me mad. It's like, there's people like me out there trying to like do the right thing, and then you have people, in the specialty just doing all the wrong things, and it's just not good for, it's not good for the field of plastic surgery when stuff like this happens.
No, it gives you a bad rep right there.
Yeah, bad rap. Florida, get your act together.
Seriously.
Crazy.